Discovering that you need a kidney transplant often creates more questions than answers, both for you and your family. MCG Health recognizes that you probably have a number of questions, and that's why we've created this video. We'll guide you through an overview of the entire transplant process. Please make a note of any questions you have so that you will remember to ask us later. As a leader in patient family-centered care, MCG Health encourages you to be an active participant in your healthcare experience. We are committed to helping you be a more informed patient. Let's start with something basic. What exactly is a kidney transplant? A kidney transplant is an operation that places a kidney from a donor into the body of a person whose own kidneys have failed. A kidney can come from one or two different kinds of donors, a deceased donor or a living donor. We'll explain the differences between the two later. For those that qualify, MCG Health can also perform pancreas transplants from a deceased donor. Why should I get a kidney transplant? For patients who are medically suitable, kidney transplants offer improved life expectancy and improved quality of life when compared to dialysis. Let's discuss the requirements and advantages of getting a kidney from a deceased donor or a living donor. A deceased donor is a person who has died from a brain injury, but whose organs are still functional and can be transplanted. Their medical and social histories have been carefully reviewed prior to organ donation. Transplant patients may be able to accept organs from what are known as expanded criteria donors. These donors are older and may have had some type of medical problem that may have damaged their kidneys slightly before they died. This will be discussed with you in more detail if you qualify to accept this type of organ. A living donor is anyone who is emotionally related to you and at least 18 years of age. However, the requirements to become a living donor are much more stringent than for deceased donors, which is why living donor transplants are less common. All living donors have their own team of transplant professionals and doctors to care for them. However, no matter how closely related you are to that donor, we are required to keep their information and care separate from yours. It is entirely up to them to decide how much information we can share with you in regards to their progress and decisions to donate, which also means that they can change their minds about donation at any time, and we must respect that decision. We encourage you to stay in touch with your donors and to keep yourself updated on their evaluation progress. Living donor transplants are often more successful than deceased donor transplants. A transplant from a living donor will most likely work more quickly, work better, and last longer than a kidney from a deceased donor. In addition, you can get a transplant from a living donor in a few months, compared to several years for a deceased donor transplant. If you have a potential living donor who is found to be incompatible with you, paired donation may be an option. This means you may receive a kidney from another living donor who is compatible with you. Your loved one would then donate to someone else who is compatible with him or her. This will be discussed in detail with you if you qualify. Let's now get better acquainted with the transplant process, starting with the pre-transplant evaluation. Your transplant evaluation started at orientation class, so you might have some insight as to what is involved. Some key points to the evaluation include speaking with a financial counselor, undergoing a physical and psychosocial exam, and meeting with the physician. Your records will then be presented at our transplant evaluation conference, usually within a month. The conclusions of the conference will be explained to you, your nephrologist, and your dialysis center. The financial clearance process begins when an MCG Health transplant financial counselor contacts your insurance company to determine coverage for both the surgery and post-transplant medications. A letter to you will soon follow, explaining your insurance benefits for transplant surgery, living donor coverage, and post-transplant medications. A prescription coverage plan is also necessary, since the costs of the medications may result in significant monthly co-payments. Our financial coordinators and dedicated fundraising coordinator will assist you in determining and achieving your fundraising goals if necessary. Any questions about your financial plan can be directed to our financial coordinators. We want to make sure you fully understand how your insurance covers the costs involved and what you should expect from a financial standpoint after the transplant. During the waiting period for your donor, you'll be assigned to a nurse coordinator who will work very closely with you to complete any additional testing and keep your records up to date. Be sure to notify our office if your health, contact information, or insurance coverage changes. If you are approved for transplant, your name will be placed on the wait list for a deceased donor transplant, and any living donors you have will begin their evaluation. There are 3 important tests that must occur as part of this process to determine donor and recipient compatibility. First, blood type is confirmed on both donors and recipients to ensure that the blood types are compatible for transplantation. Second, your antibodies are determined. Antibodies can attack donor kidneys and may be due to a previous blood transfusion or organ transplant, or after pregnancy in females. High levels of antibodies may make it more difficult to find a transplant for you. Each month, we will receive a tube of blood from your dialysis center to test for antibodies that you may develop. Third, a cross-match, or a mixing of the donor's and recipient's blood, is performed to determine if your antibodies will fight off your potential donor. Also, antigens, or genetic markers located on your kidneys and white blood cells, are determined to indicate how closely the donor's kidney resembles your own. When a deceased donor organ becomes available for you, the MCG Health Transplant Coordinator will call, which means you must have a working telephone. The coordinator will have only 1 hour to find you for you to accept the organ, so it is very important that everyone in your home knows to answer the phone at any time, no matter whom the caller may be. You will be given ample time to travel to our hospital. You're required to have a reliable transportation plan for the pre- and post-transplant appointments and the transplant surgery. You should bring any medications you are taking, insurance cards, peritoneal dialysis equipment, and any comfort items you'll want during your stay. MCG Health allows you to have a family member or friend stay in the room with you, so please advise that person to bring any personal items that they may need. When you arrive for the transplant, you will be instructed to report to MCG Health Medical Center, 4th floor south. Blood will be drawn for a cross-match, and other general lab tests as well as x-rays and a physical exam will be performed. It will take several hours to become cleared for surgery. If a problem is found or if you are not found compatible, you may be discharged home. Once you are in the operating room and prepared for surgery, the kidney transplant procedure will take about 4 hours to complete. If simultaneous kidney and pancreas transplant surgery is being performed, it can last up to 8 hours. Following the transplant procedure, you will be moved to the recovery room and then back to your room on 4 South. Patients that receive simultaneous kidney and pancreas transplants usually spend 24 to 48 hours in the intensive care unit after surgery. Hopefully this video has answered some of your questions about the transplant process. And as always, if you still have questions or if you have new ones after watching this video, please let us know. Thank you for choosing MCG Health as your place of care.